using long lever arm from positional release therapy or PRT concept. আবার 1 2 3 4 5 6 7 8 9 1 0 10 ছেড়ে দিন। So today we are going to treat sciatica with low back pain because of slip disc. But before that we need to ask all the regular questions, isn't it? So welcome to Remove Pain Clinic channel. Our patient today has been suffering from left sciatica. So let us ask her daughter as to what she is suffering from. কত দিন থেকে মা এই কষ্টতে ভুগছে আর কি, কোমর থেকে ব্যথা যেটা সেই ব্যাপারটা?
এটা নিয়ার অ্যাবাউট 2 মাস থেকে
2 মাস মতো। কি করে উৎসটা হলোটা কি করে এটা?
অ্যাকচুয়ালি ওনার নি পেনটা মানে নিটা প্রচন্ড ভাবে এফেক্টেড। তারপরে একদিন হঠাৎ করে উনি বলছেন যে ওটার থেকেই এই যে সাইড থেকে লো মানে একদম কোমরের পোরশন থেকে একদম পায়ের নিচ অবধি
ব্যথাটা হচ্ছে। তো যেদিন আপনি আমার সঙ্গে কনসালটেন্সিতে এসেছিলেন সেই দিন আপনার 10-এর কত ব্যথা ছিল? 10-এ ছিল। সো প্লিজ টু রিমেম্বার দ্যাট শি হ্যাজ আন্ডারগোন আ ফিজিওথেরাপিউটিক প্রোটোকল. And in our Remove Pain Clinic, we do not apply any kind of modalities. We believe in exercise. So our physiotherapists who do home visits focus on themselves on giving exercises. So that's exactly what she did because we wanted to improve her strength. In the reason, if we suddenly do any kind of setting and adjustment and realignment, but she will not be able to maintain because her muscles are so weak. So we made a protocol customized for her. So our physiotherapist visited her, made sure that she has gained that amount of strength. The protocol is 4 weeks, but it's on alternate day. So roughly half of that is basically the physiotherapist visited her. Right now she's with us and she's obviously doing fantastic, but we need to take care of her any lingering sciatic involvement there. All right. So before anything, let's go and take a look at the MRI. So currently we are seeing lateral view of the MRI, and if you take a closer look in the lumbar spine, you can see there are multiple levels of slip disc, especially at L4, L5, L5S1 region. So we are going to try and get this into its own place by resetting and readjusting the lumbar spine. So what exactly we are going to do is what's going to follow. Come and take a look. Let's use the chiropractic drop table to reset the sacrum, especially S1 on L5. And 3 and 2 and 1. Bas. 3, 2 and 1. Using long lever arm to improve joint mechanics of the left SI joint and L5S1, but we are raising or asking the patient to raise the right leg. Okay, let's release the hamstring and the calves. Bas. So currently we will be using distraction of the SI joint, and we are using the straight leg mechanism. Now we are going to lock the SI joint and distract from the hip. We are using the inguinal ligament release technique from positional release therapy or PRT concept, and we are using the breathing pattern to dig deep into the inguinal canal, and now coming back up 3, 2, 1 with the help of the breathing. There you go. Next we are going to do the psoas release. This again follows the principles of PRT or positional release technique, one of the fundamental concepts in osteopathy, and hold it here for roughly some few seconds or maybe minutes depending on what we want. And I think we are good because I felt the muscle kind of melt away under my fingertips and coming back up. Bas. Oi pash fire. Now we are doing the left QL release because obviously quadratus lumborum is a muscle that kind of impinges on the sciatic nerve and the branches of the sciatic nerve. So we are going to release the QL or quadratus lumborum. It feels a little bit tensed. I'll hang in here for a little bit. And coming back up now, slowly, slowly with the help of the exhalation. There you go. So we will be using the hypervolt hyperized percussion hammer gun in and around the lumbar spine, thoracic spine and the erector spinae muscles. This helps to release the muscle spasm in a huge way. Patients have commented they felt wonderful and relaxed and calm after the percussion hammer gun. And now we are backing off slowly, 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 and done. So currently we are using muscle energy technique to release the piriformis of the left side. 1 2 3 4 5 6 7 8 9 1 0 10 ছেড়ে দিন, আবার 1 2 3 4 5 6 7 8 9 1 0 10 ছেড়ে দিন, আবার 1 2 3 4 5 6 7 8 9 1 0 10 ছেড়ে দিন, আর একটা বার 20 গুনবো 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 20 ছেড়ে দিন, রিল্যাক্স. Hold in here for a couple seconds just to go into that boundary or the new stretch area and improve the muscle balance. So I think we are good. Perfect. All right, so we are using a classical technique to adjust L4 over L5. একটু তোলো, lift, bass. Done. Here we go. On the transverse processes and on the other side. Lastly, again on the L4. Done. Bam. All right, so we are at the end of the treatment. We will ask her to bend forward, but please do remember, anyone who has sciatica, slip disc, any lumbar issues or low back pain issues are not supposed to bend forward. That's a no-no. But for testing purposes, because I believe in test, treat and retest. So we are going to do a retest and check if she is able to do it or not. সামনে দিকে ঝুঁকবেন, ঝুঁকে কোনো অসুবিধা হচ্ছে কিনা বলবেন। সামনে দিকে ঝুঁকে উঠে দাঁড়ান, কোনো অসুবিধা হচ্ছে, কোনো কিছু টান, কোনো ব্যথা, কোনো কিছু, nothing. So as you can see, she does not have any issues on sciatica at this point of time, but she has huge amount of spondylotic changes of the lumbar spine, but more so on her left knee joint. So we have to take care of her left knee joint, which has already turned into a varus or bow leg, and probably she needs some other sort of treatment to make it better. So until next time, take care, stay safe, stay healthy.